Hello everyone, welcome to the channel. So today I will be discussing about the shock, pharmacology of shock. So just imagine a patient's blood pressure suddenly drops. So the vital organs stop receiving enough oxygen and every seconds become critical. This life-threatening condition is called shock. If not recognized and treated immediately, it can rapidly lead to organ failure and death. So in this video, we will learn the pharmacology of shock in simple. So I will be discussing about what is shock and what are the different types of shock, pathophysiology of it, and what are the drug of choice for it. And even also I will be discussing about the fluid, how the plasma expanders works, vasopressors, inotropes, and corticosteroids of mechanism of action, their indications and adverse drug reaction. And few of the university questions also I will be discussing. And by the end of this lecture, we will clearly understand why different drugs are chosen for the different types of shock. So without further delay, let's get started. So before getting into the shock topic, I will just introduce about the blood. What is blood? So we already have studied in HAP subject that what is blood. So blood actually is a fluid connective tissue which helps for the transporting the oxygen, nutrients, hormones and the waste products. And after the metabolism, there will be waste materials like carbon dioxide or urea. So there are many different types of waste materials will be exposed from the cells. So that blood collects. So the blood composed of mainly plasma and the formed elements. 55% will be plasma and remaining 45% are the RBC cells, platelet cells and even the WBC. So you need to remember about the RBC cells. So RBC means erythrocytes which help for the transfer of oxygen. It has hemoglobin, so it carries the oxygen. So the cells and the tissues, organs get the oxygen through the RBC. Next, WBC. WBC again classified into agranulocytes and granulocytes, and mainly it helps for the fight against the pathogens in the infections. The platelets are the thrombocytes. So the main function of the platelets are for the blood coagulation. So here you can see the functions of blood which help for the carrying oxygen, carbon dioxide. So the carbon dioxide will be collected from the all the cells and tissues and it will be entered into the lungs. So it goes out through the expiration process and it helps to deliver the nutrients like glucose, amino acid, fatty acid, etc. And from the endocrine glands, it collects the hormones, the major function. So this hormone will be reaches to the target organs and it will start showing the action. And platelet help for the coagulation and the waste products which collects from the cells, and after that it will be reaches into the kidneys, liver or skin, lungs, so that it can eliminate it from the body. So these are the few functions, and one more is there, that is thermoregulation. So here we can see the normal blood, the temperature will be 37 degrees Celsius and the blood pH will be 7 point plus or minus 4. So there will be variation. So you need to remember the pH of the blood is 7.4. So let's begin with the shock. The definition is here. Shock is a state of acute circulatory failure in which blood flow to tissues is inadequate to meet the body's metabolic needs. We know that the oxygen is very important in our body. Oxygen and nutrients. Without these two factors, our body or cells cannot do anything. So with the help of oxygen only, there will be the formation of energy in the form of ATP. If your blood couldn't provide the enough oxygen through the blood, then what will happen? Our cells or tissues won't get enough oxygen, so there will be no energy. So then what will happen? There will be the activation of anaerobic respiration. So the anaerobic respiration increases the lactic acid and it will lead to organ damage. So the shock is kind of a life-threatening circulatory condition. For example, if you are having any atherosclerosis, heart failure, any blockage, I mean like the obstruction in the blood vessels, so it will leads to ischemia condition. So what will happen? The oxygen won't supply enough to the cells or the tissues. So it is leading to shock condition. Like you just need to remember insufficient supply of oxygen or the nutrients to the tissues or the cells, which leading to the cellular dysfunction. So if the cells are not working properly, then what will happen? There will be organ failure. So that condition is shock. So the next you can see the causes. What are the causes for the shock? The first one you can see loss of blood or body fluid. For example, if you are having hemorrhage or anemia condition, so in that case the blood loss, your body is not having enough blood, so it will lead to shock. The second one you can see the failure of the heart to pump effectively. So maybe the valves are not working properly, or you can say any blockage, atherosclerosis, any of that reason will lead to failure of heart. So that also another reason for shock. And you can see the third one is that is excessive vasodilation. So the blood vessel dilating more, then what will happen? There will be hypotension. So the septic shock, anaphylactic shock, neurogenic shock are the example for the excessive vasodilation. And the fourth one is mechanical obstruction to blood flow. So the pulmonary embolism, cardiac tamponade, or you can say any kind of blockage in the blood vessels. So that also leading to mechanical obstruction to blood flow. These are very easy causes. You can remember one or two points and these are easy to remember. So it is leading to the shock condition. So here is the pathophysiology. In the pathophysiology, you can see that it all beginning with the blood volume reduction. So there is your blood volume is reducing, for example anemia condition, or you are having hemorrhage or the bleeding somewhere. So what will happen? There will be loss of blood volume, and slowly it is leading to cardiac output also. So the cardiac output is reducing, so which is leading to inadequate tissue perfusion. Your tissues won't get enough oxygen and nutrients. So slowly the delivery of oxygen nutrients is impaired. So the cellular hypoxia. Hypoxia means insufficient supply of oxygen. So then what will happen? If the oxygen is insufficient, so the cells will switch the anaerobic respiration to anaerobic respiration. Sorry, aerobic respiration to the anaerobic respiration. So what will happen? The ATP production is reducing and the lactic acid accumulation is increasing. Anaerobic metabolism increased, right? So what will happen? There will be lactic acid accumulation, so which is leading to metabolic acidosis in the cells and tissues. So once it started, the anaerobic respiration started to compensate this activity, the body started to activate our sympathetic nervous system. So once the sympathetic nervous system started, there will be activation of our renin-angiotensin aldosterone system. So that we already know, that I will discuss in the further slides. So RAS is very important point in this topic. So once the RAS get activated, the antidiuretic hormone or our vasopressin will get activated. So it will start absorbing the more sodium. So sodium retention begins from the kidney, and for a while to compensate the condition, it actually started. If we are not able to correct this condition, like our body is trying to keep it hold, but we are not able to treat in that condition, what will happen? It will worsen the situation. There will be hypotension and there will be chance of endothelial injury and increased capillary permeability. Inflammation begins, so the interleukin, all the inflammatory mediators comes. So what will happen? There will be a reduction of cardiac output. Once the cardiac output reduced, everything will get worsen. So the tissue perfusion is reducing, and which is causing the progressive cellular damage. Cells started damaging. So if it is happening for a long time, then what will happen? The organs will be started to get damaged. If we are not treating, it is a irreversible shock and death. So if we are not treating, then it will be irreversible shock and death. So the shock we need to treat in a correct time. Actually, the renin, angiotensin, aldosterone system is very important here. So I will just explain in a very short. So first, actually it is not visible here. There you can see the angiotensinogen. This angiotensinogen, you need to remember it is angiotensinogen, not angiotensin. Angiotensin is releasing from the liver. So once the liver started releasing angiotensinogen, because of the angiotensinogen presence, the kidney has juxtaglomerular cells. So the juxtaglomerular cells actually started producing or secreting the prorenin. So the prorenin is a precursor and it is an inactive enzyme. So once the prorenin converted into renin, so renin is the active enzyme. So the renin converting the angiotensinogen into the angiotensinogen 1. So here renin converted angiotensinogen into angiotensin 1. The same time, from the lungs, the angiotensin converting enzyme is released. So once the angiotensin converting enzyme release, it is converting the angiotensin 1 into angiotensin 2. So now what will happen? The angiotensinogen helps for the systemic vasoconstriction. The blood vessels were vasodilated before. It is dilated. So with the help of angiotensinogen 2, the blood vessel will be constricted so it can help for the increase of cardiac output. When the same time from the adrenal gland the aldosterone is releasing, so which is increasing the sodium and the water retention. So once the sodium increased, sodium reabsorption is high. So then what will happen? The water level is increases in the blood. And even the angiotensin 2 can helps to stimulate the posterior pituitary lobe. So from the posterior pituitary lobe, the vasopressin also releasing. So the vasopressin and the aldosterone together helps for the water and the sodium retention. So once this process started, then what will happen? The blood volume is increasing. So once the blood volume increase, then what will happen? The cardiac output gradually increasing due to the systemic vasoconstriction. So this is the process of how the blood pressure and the blood volume is increasing. And here you can see the different types of shock, classification of shock. So like we just need to remember about the 5 types of shock. The first one is hypovolemic shock. What is hypovolemic shock? Volemic, right? So the blood volume is reduced here. So due to decreased circulating blood volume. So that is leading to hypovolemic shock. The second one is cardiogenic shock. So cardio means it is a heart. So the heart is not pumping efficiently. So then what will happen? Cardiogenic shock. The third one is distributive shock. So the abnormal distribution of blood flow which is leading to distributive shock. You need to remember about the vasodilation. And the causes you can see here. And the obstructive shock, in the obstructive shock, any obstruction in the any blockage in your blood vessels will leading to the obstructive shock. And the neurogenic shock means which is due to the failure of autonomic nervous system or the autonomic regulation will leading to the neurogenic shock. So these are the 5 types of shock you need to remember, and their definitions are here. Causes also I have given. So what are the causes for the hypovolemic shock? So there are many reasons are there: hemorrhage, burns, dehydration, vomiting, diarrhea, third spacing. So there are many causes which is leading to hypovolemic shock. And the features, the preload in the arteries, the preload is reduced, cardiac output reduced, tachycardia, hypotension, cold clammy skin, that because of hypotension. So this you need to remember, and it is very easy to remember here. Next, cardiogenic. In the cardiogenic, of course it happening in the heart is not able to pump efficiently. So the causes are myocardial infarction, severe heart failure, arrhythmia, and valvular heart diseases, myocarditis. So these are the reason for the cardiogenic shock. And in the key features, you can see here also the cardiac output actually reduced, but here the preload is high. In the case of hypovolemic, the preload was reducing, and in cardiogenic the preload is high in the atriums, and hypotension same, and pulmonary congestion also here, that because of heart, if the heart is not pumping the blood sufficiently, so it is affecting your lungs gradually, and cool extremities. So you can remember these points. These are the key features and the causes are here of cardiogenic shock. Next, distributive shock. The distributive shock, you need to remember the first one, that is septic shock. For example, if you are having any infection or infection, then it will leading to the septic shock. So septic shock is one of the example for the distributive shock. Next, anaphylactic shock. For example, if you are having any allergy, pollen or honeybee, so these are the reason for the examples for the anaphylactic shock. Next, neurogenic shock also leading to distributive shock, and endocrine shock. So these are the causes for the distributive shock. And here the SVR is reducing, the pressure between the blood vessels are actually reducing, and here it is warm extremities, and the case of hypovolemic and the cardiogenic, it was cold extremities, and here in the distributive shock it is warm extremities, and hypotension same, and wide pulse pressure. So these are the key features of distributive shock. And next you can see the obstructive shock. In the obstructive shock, you just need to remember there will be blockage in the blood vessels. So pulmonary embolism, cardiac tamponade, tension pneumothorax, and constrictive pericarditis. For easily you can remember about the pulmonary embolism, or even atherosclerosis also you can remember. So these are the blockage which is leading to the obstructive shock, and the cardiac output reducing same here, and distributive shock and obstructive shock are having high preload. Cardiogenic shock and obstructive shock are having high preload, and hypotension same here, and jugular venous distension. So jugular vein, you can see in the neck area. So these are the details of obstructive shock. The last one is neurogenic shock. So neurogenic shock means it is a loss of vasomotor tone, or you can say autonomic dysregulation. So causes are spinal cord injury, any anesthesia condition, like for rare cases anesthesia will lead to neurogenic shock, and spinal shock. So these are the causes, and here also vasodilation, the blood vessel dilated, and here you can see the bradycardia, and in the case of hypovolemic it was tachycardia, hypotension, and warm and dry skin. So this you need to remember, this table, this classification will be useful for your exam. So classification of shock is very important.